World AIDS Day is our opportunity to increase education and awareness about HIV and to motivate people to get tested. Back in August, Mayor Emanuel and I released Healthy Chicago, which is our plan to transform the health of our city, and we've identified 12 priorities. This is one of those 12 priorities that we've identified. But this is really a kickoff. In 2012, we are committing to distributing over 10 million free condoms throughout the city. So we're going to be at different CTA stops distributing 20,000 free condoms this morning. Currently, we have over 100 different locations where people could get there and get free condoms throughout the city.
We do an odd number of programs, and primarily what we do is HIV prevention and education. One of the other programs is through our condom distribution program. What we've done is identified a lot of different businesses and non-traditional venues, of course, where we were able to set up condoms or set up boxes, and with that, we have our agency's information. So we want to make sure we offer it to you as, because you guys do move a lot of condoms out here, and you do so well up here, so.
Condoms in the dry cleaner, I think that's the most surprising one, but it's been doing great so far. People need to know more about protecting themselves with the condoms, and you don't want to go out and catch a risk. Everyone needs to protect themselves. You don't want to not have a condom and, come with risk of pregnancy or any type of HIV or any other disease. So we promote, safe sex. So I think it's a great idea.
In Chicago today, we have 20,391 people living with HIV, but we think there are additional 5,000 that have HIV that they're not aware of their status. So it's really important to get tested. But if you look at over the last 30 years, we've come a long, long way. Just in the last 10 years, we've seen a 40% decrease in the number of new cases of HIV. And this is in part as a result of, all of our efforts and our partners' efforts to increase awareness. But a couple of things are still concerning to me. One, we are seeing a shift in age distribution. More and more younger people are getting diagnosed. We know now the ages 20 to 29 constitutes 33% of the new HIV diagnoses. And the other alarming things is we're not able to close the disparities yet. We, for example, for every 10 white persons diagnosed with HIV, we have 30 African Americans. So we know that African Americans are disproportionately impacted by HIV. There are plenty of locations where you can get tested for HIV. All those locations are listed on our website, cityofchicago.org/health. And if somebody wants to tweet us, we'll be more than happy to tweet them back at Chi Public Health about the nearest location for them to get tested.